Good evening. My name is Chris Redmond, and I am the treasurer for the board of directors. It is a pleasure to give you a brief overview of the audited financial statements that are contained in your information kit. The financial statements have been accepted by the board of directors and are presented for adoption tonight. My comments this evening will be summary in nature. If you want more detailed information, we will certainly be pleased to answer any questions during the question and answering period during the agenda. For the fourth consecutive year, HSN is actually very pleased to report that it has balanced its financial operations. HSN has done this while delivering high-quality patient care in an environment of significant pressures, including funding constraints. This slide actually shows comparative financial information. In 2014-15, revenues and expenses were approximately $450 million, with a reported $117,000 surplus. In 2015-16, both revenues and expenses grew by approximately 2% and are reported just over $460 million, and with a surplus obviously this year of before one-time events of $283,000. Significant variances from prior year include salaries, which are $8 million or 4% higher than the prior year due to the addition of new programs, labor rates increases, and the impact of increased patient activity. Increases such as patient days being 15% higher, emergency visits being 2.3% higher, occupancy being generally 100 or over 100%, and length of stay being 2% higher resulted in approximately 3.5 in additional costs. In 2015-16, HSN was required to undergo an actuary evaluation on employee future benefits, and as a result, a $3.2 million reduction of two benefits was recorded. Medical surgical costs are 3.5% better than prior year, mainly due to improved contract pricing through MedBuy. Drug costs are 21% higher than prior year due to inflation, an increase of reimbursable drugs, and an increase in patient activity. So moving on to working funds, HSN is also pleased to report that for a third consecutive year, the working funds obligation with the Ministry of Health and Long-Term Care was met, and as a result, another $19.3 million of one-time funding was secured. This funding is reported under one-time items in the Statement of Operations, and as per the agreement with the Ministry of Health and Long-Term Care, these funds cannot actually be spent. The total one-time funds received for working funds is $57.9 million, and while the agreement continues for another 2 years, no additional one-time funding will be received after this year. If I can turn your attention to HSN's capital spend for 2015-16, HSN shows an increase of $30 million in capital assets, where $9 million is due to a transfer of assets from Cancer Care Ontario, leaving $21.3 million. Some of the examples of capital purchases are surgical tables for $102,000, portable X-rays for $300,000, and investing and maintaining buildings at a cost of $6 million. HSN also spent $3.2 million this year in a project called Advanced Clinical System, a multi-year project that will change the way we share patient records across the healthcare system. We are also nearing the completion of the parking lot expansion and invested $3.7 million in this project through 2015-16. Finally, HSN purchased neurosurgical and microscopes totaling $378,000, which will also improve how we treat our patients. So this concludes the financial report for 2015-16. We have a motion to accept the audited financial statements, and I'll read the motion. That the auditor's report and the financial statements for the year ending March 31st, 2016 be adopted as presented, and may I have a mover and a seconder of this motion or for this motion? Thanks, Mike. Seconder. Thanks, Roger. All those in favor? Opposed? This motion is carried. I have a second motion as well that I'd like to bring forward, and this motion before you that deals with the annual appointment of the auditors. Accordingly, I would now like to present this motion to the corporation, which reads that the firm of KPMG be appointed as auditors for Health Sciences North for the fiscal year 2016-17 and until the next annual meeting. May I have a mover and a seconder for this motion? Roger and Paul, thank you. All those in favor? Those opposed? This motion passes. Thank you. This actually concludes the financial portion of this evening's meeting, and I would now like to invite Stephen Petrovic to the podium to present the bylaw amendments. Okay, Stephen?